So doctors, please, now let's keep it very simple. What are the kind of situations which will cause a patient to breathe slowly? The patient is on mechanical ventilation. If the patient is underventilated, if the patient has CNS depression from whether drugs or whatever, if the patient has a head injury, the patient will be breathing slow. If the patient has opiates overdose, the patient will be breathing slowly, right? If the patient is on benzodiazepines, some illicit drugs, if the patient has chronic obstructive pulmonary disease because the patient is trapping air, if the patient has kyphoscoliosis, if the patient is hypoventilating due to obesity.
Yes, doctor.
Dr. Brunner, I have a question, please.
Please.
Thank you very much for a wonderful presentation. The slow breathing and the shallow breathing, are they the same?
No, slow breathing is actually slow. Like if the normal respiratory is like 14 to 16, maybe 7 cycles per minute. Shallow breathing could be that the patient is doing 16 cycles per minute, but the patient is not filling his tank. Right? He's not filling the lungs well. So he's doing normal breathing, but it's very shallow. So he's not getting enough oxygen to blow out the carbon dioxide. So that person is also retaining carbon dioxide, right? Okay. Now, so this is just a recap of everything we've done before we start solving questions. So respiratory acidosis. Now I can even just shout. Okay, I have a question. Respiratory acidosis, what will happen? Let's even talk about arrows. Let's talk about arrows. Respiratory acidosis. In respiratory acidosis, does HCO3 count? Yes or no?
No.
So in respiratory acidosis, I'm expecting pH arrow to be up or down?
Down.
I'm expecting CO2 to be up or down?
Up.
And then because they are in opposite directions, I don't even consider HCO3. Doctors, are you seeing what is happening now? Okay, good. Now let's go. Respiratory alkalosis. Before we even go to this one, respiratory alkalosis, I'm expecting pH to be pH arrow to be up or down?
Up.
What about CO2? Up or down?
Down.
Will I consider HCO3?
No.
And what are the causes of respiratory alkalosis? If the patient is breathing fast, I was just chased by a lion. Hey, the patient will breathe fast. Hyperventilation. Dr. Bonnie, I feel that Mount Everest is falling on me. Anxiety. Maybe I'm also on a mechanical ventilator, but the doctor who sets the ventilator put it too fast. So, respiratory alkalosis. So, mechanical ventilation, it depends on the settings. If it is done wrongly and the patient is made to breathe slowly on the ventilator, it can cause respiratory acidosis. But if it is done so that the patient is breathing too fast on the ventilator, it can lead to respiratory alkalosis. Hello, doctors. Hello. Are we all on the same page? Yes. Beautiful. Please speak. Dr. Nabi?
Hello, doctor. Thank you for your presentation. I had a question. If there's going to be like pH and carbon monoxide is not going to be. So carbon pH is there, so bicarbonate is also there. So what should we do on that time then?
Sorry, what's your question again? Take it again, please.
I said if there's going to be in question pH is there, bicarbonate is there, but carbon dioxide is not there. So how we should figure out those?
It's not going to happen.
Not going to happen?
No.
Okay, thank
you. It's not going to happen. Don't forget you're writing a board exam. Okay, good. Next one. So respiratory alkalosis. I'm expecting pH to be up and I'm expecting CO2 to be down, right? Forget about HCO3. As soon as pH and CO2 go in two different directions, Forget about the marriage counselor. Marriage is over, done. They are going to see the divorce lawyer. The CO2 is going to take the house and kick pH out of the house. Right? Okay, good. Now, what about metabolic acidosis? You remember that was what I was talking about. In metabolic acidosis, I'm expecting pH to be what?
To be
Hello,
down.
And then when will it become metabolic? Because CO2 will also be going down. And therefore, I need to invite the marriage counselor, which is HCO3. And when HCO3 also comes, he is also going down. So in metabolic acidosis, think pH down, CO2 down, HCO3 down. Decrease pH, decrease CO2, decrease HCO3. And what are the causes of metabolic acidosis? End-stage renal disease, diabetic ketoacidosis, lactic acidosis. These patients will immediately attempt to balance their low amount of HCO2 with respiratory saturations by blowing off oxygen. And that is why they develop Kussmaul's breathing. But let's not worry ourselves so much. QE1 is not a lot about pathophysiology and the rest. No. QE1 is about simple concepts. Okay, so metabolic acidosis will be down. So without even looking at metabolic alkalosis, what will it be? Metabolic alkalosis, what will it be? Without even going to that up. That's it. That is it. It is often seen in patients with vomiting, excessive diarrhea, excessive acid use, excessive diuretics. There's increased pH, increased CO2, increased HCO3. And these patients, they attempt to compensate by decreasing respiration to build up acid in attempt to correct the pH, right? But don't worry your head about that information. Just when you are reviewing, you just go back and look at it. So metabolic alkalosis up,